with a local leader on the front lines of the COVID-19 pandemic in our area. Tonight, we kick things off with Winnebago County Board Chairman Frank Haney. Frank has been a leading figure in the fight against the coronavirus in our area. Chairman Haney, obviously we're practicing social distancing, joins us via Zoom video conferencing tonight. Thank you so much for taking time to join us tonight, Chairman Haney.
Honored to be with you. Thanks for having me.
You started your press conference today with asking the public to wear a mask. You and Dr. Martell, Mayor McNamara had masks on. You said, quote, "You may have COVID-19 and you may not know it." Can you expand on that and the number of what could be asymptomatic carriers in our area?
Sure. So last Friday, the CDC and IDPH, which is the state level health department, changed their position and said that they're recommending now that folks wear a mask. And so we wore them today. There's been study after study that says that 25% of transmissions of COVID-19 occur when people have no symptoms, they feel fine, they have COVID-19, they're contagious, but they feel great and they're going about their daily business and they are transmitting the virus. And so wearing a homemade mask, wearing a bandana around your mouth and your nose, it doesn't necessarily protect you from contracting COVID-19 the way that an N95 mask would protect a doctor or a nurse. What it does is prevent you that when you're talking or coughing from transmitting those droplets they talk about to somebody else. The most important thing though, James, is social distancing, that 6-foot rule, and of course stay home whenever possible. But we do know people do need to go to the grocery store. We do have a large number of people who are working in businesses that are considered essential. So we do have movement in our community. We want to limit it. We want to respect social distancing, but the mask piece is just another piece of the puzzle.
And we saw a massive projection by the health department today, including 59,000 people that could become sick with COVID-19. That's a huge increase from where we are today. If it rises that sharply in such a quick time, the projected peak time, can our hospitals handle it?
So what you saw today was in fact a very, a big number and a scary number, in a community that has, in the range of 290 some thousand residents. The projection of 59,000 people contracting COVID-19 over time was shared. That's what the modeling suggests here in Winnebago County, and that is a big number. The thing we need to understand is that if we do not flatten the curve at any point in this discussion, right now we have to admit we don't have a vaccine. We do not have a way of stopping the transmission, with the exception of staying home, practicing social distancing. If we don't flatten the curve, then we will, in fact, as we've seen in other countries, as we are preparing to see in place like New York, you're going to overrun your ability to provide care. Not everybody, as we know, will need elevated care or hospitalization, but it's important to understand it this way. If 100 people get COVID-19, James, 81 of them can recover at home with mild symptoms. That's the majority of our residents that could get it are going to be able to recover at home. 19 of them will require hospitalization. That's based on, studies over thousands of people. Of the 19 people in this example, 6 will need an ICU bed. 3 of that group would need a ventilator. So if you see a surge, and we are expecting a surge towards the end of this month, not this week, as much as 2 to 3 weeks from now is when we'll see our surge. So when you turn on TV and you see somebody at the national level talk about this week, they're talking more about New York. What we are seeing and what public health officials are projecting is towards the end of this month is going to be the surge time, and our healthcare partners are working very hard to prepare for that.
And that leads me actually to my next question. Why is our projected peak a week or two later than what we hear Governor Pritzker say and what we hear the president say at the national level?
Yeah, the governor talked about over the next couple of weeks, we may be, several days or a week behind Chicago, but we may be a couple of weeks behind New York. So, it is hitting. New York's ahead of us, just like Italy was ahead of New York. It has a lag time. We're not that much offset from Chicago, but again, based on projections, and projections can change as more information comes in. But we are not looking at Easter week being the surge week or the week after. It's probably 2 to 3 weeks from now, end of April or very early part of May.
Last week, we saw countless people congregating in parks across our area. You spoke very harshly against that. Tomorrow is supposed to be 73 degrees in our area, going to be hot across the state of Illinois. What is your message to people who just want to get out of the house?
Yeah, get out of the house, go for that walk. Go for a walk with your family. You can shoot a basket in your backyard, just do it alone. What we don't want is, a pickup game of 10 kids from 10 different families, breathing on each other, sweating on each other, not knowing that one of them may have COVID-19. And then we pass it around and then pass it on to our parents or perhaps an elderly grandparent or somebody with an underlying condition or a frontline worker, that type of thing. That's how this stuff spreads. We're adjusting to that reality. I'd also say this, there's a lot of people who feel good now and it's spring. Having an intimate party with your friends or extended family is not a good idea. It's not as visible as playing basketball at the park, but you can pass it around and extend it to extended family and then throughout the community. Just as easily that way as well. And, I mentioned today, James, this is unprecedented intrusion into our lives with the shutting down of business. Our churches are not open. I'm Catholic. This is like the Super Bowl for Christians. It's Easter week and churches are not open, but you see pastors and priests and religious figures supporting this idea almost universally, because they want people in their churches to be safe. No different than we want our young people and our not so young people to be safe as well.
Yeah, I watched Palm Sunday at my house on the big screen TV in the living room, so I understand that. Kind of building off that, judging by the graphs shown by Dr. Martell that we saw at the press conference this afternoon, we're kind of at the beginning of this for Winnebago County. What encouragement do you have for people who may have already been social distancing for 2 weeks, been home for 2 weeks? How do we stay the course?
Sure. So, if we have to double down, this is as critical of a 2 to 3 week slot. So what we do today, we do not see the impact of tomorrow. What we do or don't do today will impact greatly how things look 2 or 3 weeks from now. And just like we have people walking around with COVID-19 that are transmitting it and they don't know it, there's that period of time before people start to have symptoms where what you do today matters. If we don't flatten the curve, people will not get ventilators when they need them. They will not get elevated, care like ICU beds or hospitalization. That does not mean that our hospitals are not working together to prepare for a surge, but it takes citizens working and doing what they need to do, as well as our healthcare partners. I can say this, our healthcare partners, James, very proud of them. We have one health system, 3 hospitals working together as one system and one team. We're ready for what's coming. They're doing their part. Now we as citizens have to do our part to lessen and flatten that curve as much as possible. It matters and it will save lives.
And we thank them on the front lines as much as we thank you on the front lines. Winnebago County Board Chairman Frank Haney, thank you so much for sharing a little bit of expertise with us tonight on 13 News at 6.
Thank you, sir.
We'll send this over to Chief Meteorologist Alex Kirchner, also working from home, with your forecast.
Well, I'm live from my home office.